You're welcome to yet another edition of The Issues. I am Sukaya UC and this is N24 TV, your innovative news, information and entertainment. It's called The Issues like we always do. We bring prominent people when it comes to health, when it comes to education, when it comes to everything that people need to talk about. And this is called The Issues like I said. And today with me here I have Mr. Ousman Darboe, who is Dr. Darboe rather, who is a nurse actually and also a midwifery. Mr. Darboe, you're welcome.
Thank you. Thank you.
Okay, like I said, you're welcome to N24 TV. Today we want to focus on, since you're focusing on midwifery and also specialized, you're also a nurse too. So first of all, we want to come to when it comes to pregnancy. Because when we talk about midwifery, it has to do with these things. So the first thing that Gambians all have an issue with rather, is maternal mortality rate, the death rate when it comes to delivery. So what exactly do you think is the cause of this?
Thank you, Suke, and thank you for inviting me to N24.
You're welcome.
I am Ousman Darboe, and a senior program officer currently working with the Directorate of Health Promotion and Education as a senior program officer for maternal and child health nutrition.
Okay.
And when we say maternal, we mean pregnant women and things related to pregnancy. And I also work on different hospitals as senior midwives in labor wards. And I think that's the reason I'm invited here today.
Sure.
When you discuss about maternal mortality, it is not something that is easy to address. Because we have different causes.
Okay.
And under these causes, we call them the 3 delay model. Okay. You have things that have we call the direct causes of maternal mortality. For example, a woman delivers and there is bleeding. If the bleeding is not controlled, the woman can die.
Okay.
And sadly for our country, I think we're trying to improve, but 44% of our women as of 2019 are already anemic, well before getting pregnant.
Wow.
So we're looking at 44%, and that increases during pregnancy. Because in pregnancy, of course, the demands increases and obviously the need for iron increases.
Yeah.
And then you have more anemia in pregnancy. So if a woman is anemic and goes into labor, obviously if there's small bleeding, the woman can be anemic and obviously can need blood. So hemorrhage is a major cause that we call bleeding during pregnancy.
Okay.
We have different causes to hemorrhage.
What causes this hemorrhage?
Hemorrhage means bleeding. And
Okay.
normally when a woman delivers, there is bleeding, there is blood. Because pregnancy goes with, delivery goes with blood. But there is a limit to this bleeding. We
Okay.
said less than 500 mils of blood should not be lost during delivery.
Okay.
But if you deliver and you have problems like your uterus not able to contract, the uterus simply means the womb. If the womb is not able to contract and to control that bleeding, obviously the woman will continue to bleed. And secondly, if you have anemia, even the slightest bleeding you have, you will be having what we call postpartum hemorrhage. Because also when it comes to the definition of this hemorrhage, it also has to do with what makes the woman having physiological instability. If you bleed even only 200 mils and you have showing signs and symptoms of severe anemia, we consider it as postpartum hemorrhage. Okay, and the other issue is a woman can deliver and then you have tears around. Some of the things that can cause that, for example, if someone underwent FGM and all those things,
Okay.
or if the woman is not that much developed, because we know if you are less than 20 years of age or less than 18, you are more likely to have complications.
Yeah.
So
During delivery.
During delivery. So during the delivery, if you have those tears and lacerations, and if they are not well taken care of, definitely you can have this bleeding, we call it. And sometimes you can have issues that has to do with rupture of the uterus. That can happen when there is delay. You have contractions, serious contractions, you didn't come to the hospital early, or of course you come to the hospital early, but the management also is not taken as it is supposed to be.
Okay.
You know, when you're talking about causes, we will have to talk about both sides. Okay, those are things that can actually cause this bleeding. And the other thing that can cause the bleeding is the issue of the placenta. Placenta is the attachment that supplies nutrients from the mother to the baby.
Okay.
We know the baby does not eat when it's uterus. So anything the mother eats, that's what the baby takes from. So that's the attachment that is there, the placenta, and then you have the umbilical cord. So one thing that's also important is the positioning of that placenta. If the placenta is at the lower uterine segment, in the lower part of the womb, there can be problems. But the way to avoid that, we have to do our scannings. Scannings are very important. at least it is recommended that the woman have 3 scannings in pregnancy.
During pregnancy,
Yeah,
the woman should,
first 3 months, second 3 months, and the third 3 months, because pregnancy is 9 months.
Yeah.
So we divide them into 3 months. We call them trimesters. So if a woman have a first scanning in the first 3 months, the woman will be able to know that yes, it is the pregnancy even in the uterus in the first place. You can have a pregnancy and the pregnancy is not in the uterus, but the scanning can show that, and the interventions can be taken to make sure that the woman doesn't have any complication.
Talking about scanning, can women have the opportunity to do this scanning anywhere they in the country?
No,
or is it limited to only few health centers in the Gambia?
I would not say anywhere in the country. I know we have our district hospitals. Most of them are having scanning, and also some major facilities, but not everywhere. That's also a limitation. I know many women will not have access to scanning, and even if you have access, also the financial concern, because I know for most of the scanning you have to pay before you get the scanning.
Okay.
So there are people who are trying to feed themselves, and you want them to go and pay 250, 300 for scanning. Obviously, it also has some implications.
Okay.
So to continue with the hemorrhage, when the placenta is not well attached and it is not detected early, obviously the woman goes into labor, you can have issues related to bleeding like that. And the other issues that can cause maternal mortality is obstruction. Because when a woman is in labor, it's just like a vehicle. When we come in, we pass through the door, because the door is bigger than us. But if I am too big to pass through the door, you think I'll be able to pass? No, I will not be able to pass. So if you're pregnant and the baby is too big to pass, or the baby is lying in a position that is not favorable to pass through the pelvis, okay, that's the hip bone, obviously that will be what we call obstruction. Okay, and those are things that scanning can detect abnormal presentations. Your routine antenatal services can also detect that, and then scanning will also be able to tell you whether this baby is too big to be able to pass through this pelvis. So that's why one thing we have to focus on is the antenatal services. Most of the things can be prevented during the antenatal. Antenatal means what? Before delivery. All the services you do when you are pregnant. And these are things that also need to be taken up. Okay, so these are 2 of the major causes. Other things are the hypertensive crisis. Hypertension also is very, very common in pregnancy. And we have people who are pregnant and then they have hypertension. Then after pregnancy, the hypertension disappears. And there's some that continues with the hypertension after pregnancy. But one thing that is key with that hypertension is also the early detection and the management.
Okay.
Yeah, even if you are hypertensive, there can be management. You can take your medications, and you can be taught on the signs and symptoms to observe, so that in case you are going into severe form of hypertension where the woman will be falling down, convulsing, and all those things. So these are few of the things that we have a lot of causes that we want to discuss. Well, we have a direct and also the indirect causes we will also discuss as we go on.
Yeah. So since you're also under nutrition, I guess it will also be very good to take us through the things or the type of food that pregnant women are supposed to take in, or maybe the preventive measures as to avoid all these things that you've listed.
Yeah, I think when it comes to pregnancy, the nutrition component is very, very important. And we want to advocate those things to start before pregnancy. And unfortunately in our country, we don't usually have preconception care. We don't have those cares that women seek before getting pregnant.
Okay.
And then people just get married and they get pregnant and without knowing 1 or 2 things. But the preconception care is very, very important. And their nutrition also is very, very important. Because if, in fact, research has shown that if a woman is not well nourished, goes into pregnancy, the baby also will not be well nourished, and there can be consequences or poor bad outcomes. Okay. But if there is proper nutrition, and when we say what can you eat, we say balanced diet, and it's very difficult to determine what balanced diet is. I think that's why as a directorate we also working on developing what we call the food-based dietary guideline,
okay,
where we can tell a layman, when we say 50 milligram protein, these are the foods that can give you that. You know, that's the difficult thing, but that has to go to rigorous research to be able to tell people that. So you have to take from different variety of foods. The fruits are fruits and vegetables are very, very important. Your sources of protein, the animal meat and other things, or animal sources, and also you have your fish and other things that you can take. Even groundnut is a very good source of protein. Okay. And you have the largest proportion of food that we want to eat is the carbohydrate. the rice, the cassavas and others. But you know, unfortunately
The bread.
In the Gambia, we have food we call they are rich in quantity but not in quality, because people eat to fill the belly, because if there is not much cash, you don't decide what to eat and what not to eat. So those are things that what we have to prepare for pregnancy by being well nourished. And then also you also need to know your hemoglobin level. Hemoglobin is also related to your diet that you eat, because it's iron and the folic acid that make blood. So if you have those things, definitely you will be able to if you eat very well, you can be able to address those 44% of women that are anemic. They need to be addressed before going to pregnancy. Okay, so conception care is very important. And the other part we will look at is during pregnancy. We know at the early stage, women do vomit. They have loss of appetite. So obviously,
the early stage of pregnancy,
the early stage of pregnancy, that's expected. Okay, and if it is not very serious, if it is serious that anything that woman eats and the woman is dehydrated, there might be admissions. But for the woman to be able to eat and have some small vomiting and other things, and anorexia means loss of appetite, definitely that is expected. So during that period, women should be encouraged to eat small but frequent. You know, if you eat large amount of food, obviously you'll be able to vomit.
Sure.
But you eat small and frequent, obviously you will be able to retain what you eat. Okay, and then also the issue of the eating from different variety of foods. And in the Gambia, we know many people don't like vegetables. And these are things that are very rich in iron. And these are things that are very rich in folic acid. And then they can improve the hemoglobin level. And then one thing that is certain, like I told you earlier, anything that the baby gets from the mother. And then there's one funny thing about the baby. Baby doesn't know whether my mom is having less, let me reserve. No. As long as the baby needs something, it will get it from the mother. Even if it means the mother to be going without any food. So that's why the mother has to eat enough. Because the baby will not know, okay, my mother is having less, let me stop taking. No. The baby takes after. So obviously, if you're not taking, the baby is not having, you will not be growing normally, and your baby too will not be growing normally. And if the baby does not grow normal, obviously there is chance of that baby dying compared to a baby that is growing normal. So
meaning if you were eating half of bread before you got pregnant, during pregnancy you should be eating
you should be eating more, because even physiologically it will be pushing you to eat more, because you get more hungry. You see, pregnant women eat very well. I don't know whether you observe it, but they eat, because that's a demand. Because the desire to eat, it determines by what you have in your blood system. Okay, if your blood, there is what we call the nutrients are not enough in your blood, you will be hungry to eat. So pregnant women, usually when they are free from their illnesses and all those things, they can eat very well. You've been observing them, they can eat very well. But you have to eat. Nutrition is very important. Before pregnancy, after, during pregnancy, and in fact after pregnancy, during the breastfeeding period is very important.
Apart from the nutrition side, the eating side, what other preventive measures do you think will reduce this maternal mortality?
The maternal mortality, the preventative, let me start with the communities. And sometimes these are very integral part that people forget. Okay, within the community, people should be very supportive to the pregnant woman. Okay, pregnancy, yes, is carried by the woman, okay, but the husband or the partner or even the household member should be able to support that individual. That's why we advocate for every pregnant woman to be accompanied by the husband. But we're having challenges in that.
When going to the hospital?
When going to the hospital, either the husband or the partner, the person responsible for the pregnancy, okay, should be there. If you go with your partner to the clinic, and you had the nurse or the nurses they are telling you, you have to take your FIFA, that's your iron tablet, you have to take food and all those things, you will be the one to encourage the lady if you go home. If you go home, if you notice that my wife is not taking the iron, obviously you'll be able to remember and tell the wife, take your iron.
Yeah, sure.
But if you don't go at all, you'll not be able to know. And then if your wife comes home and tell you, yes, I should be eating meat and I should be eating fish and all those things, you would think those are ways of the wife getting some things out of you. But if you are there and everything is told in your presence, definitely you will be able to know what the woman wants. And secondly, the support from the family. You know, a pregnancy needs a lot of rest. Okay, a pregnant woman should not be working continuously like a slave in the house. We have to be clear on that, because you need to rest. And because when you rest, that's the time you also regain your energy. Okay, it's a period that you need to rest very well. So there should be support from the family members. Okay, and also to encourage the woman. And pregnancy also goes with a lot of psychological stress because of the stress of the pregnancy and also the stress of the hormones that are acting on you. A pregnant woman is usually very short-tempered.
Very short-tempered. That is
short-tempered,
very true.
yes, and it's not under her control, but there's something that she cannot control. So the family need to understand that. You can observe during those days, I don't know whether it's still happening now, a lot of marriages break during pregnancy because men and the family don't understand that the woman is getting angry all the time. It's not her attitude, it's the hormones that are acting on her. So there should be that psychological support. Okay, if you see that your wife is getting angry every time, understand that it's the pregnancy, it's the hormone. And after the pregnancy, obviously it will disappear. Okay, those supports has to come in. Okay, and also from the community, we have to make sure that when women are in labor, okay, they try to go to the clinics early. We have to make sure that our women attend antenatal clinic. It's very, very important. Our women should attend antenatal clinic because that's the period that they try to detect a lot of problems. If they don't detect the problems will, early detection is very, very key. If we detect it late, there will be issues. So those are things that are very, very important in the community. And that's where the delays come. We have delay in seeking service. Okay, you are in the community, the woman is in labor having back pain, and traditionally it's the old women in the community that decides to tell you, okay, you can wait for a while, you have to be strong and all those things. Yes, the woman has to be strong, but the woman needs to get to the clinic or to the hospital. It's very, very important because that's the time anything that is detected early can be taken care of. But if you wait until it is late and things are rushed, usually there will be problem. And also we have another delay in getting to the facility. Now you've decided that yes, we are going to the hospital. If it is in the combos, we say, okay, you have to pay town trip. That's costly. Okay, probably the husband has to go and run and get some money for all that. And that's all that takes time. And also you also need to pay transport. You pay transport, but now the traffic is jammed. Okay, in the provinces, the problem now becomes the transport availability. Because you know when a vehicle passes before another vehicle passes, it's another thing. That's why when I was in Bansa, we had a lot of deliveries happening in buses.
Okay.
Yeah, so buses has to come with people who already delivered in the vehicle, in the gele-geles and all those things. So those are things that are very, very difficult for the family to do because it has to do with economy. So if you also want to address maternal mortality, you also have to address the economic or the income earning of the family. If they have more income, they'll be able to do that. Okay. Now you also come to the another delay where we say delay in receiving service. You get to the hospital, probably because there's not enough material, or probably because the person there is not well trained, or probably the individual there is also constrained. You have more people to see. So all those things can delay services. And then the major issue in the Gambia is the issue of blood. Yeah, you come and say there's no blood. This hospital never have blood, but blood is given by people. There is no hospital that manufacture blood in the Gambia. So people have to know that any blood that you see in the hospital is put there by people. Fortunately for us, while we were in Bansang, we had a very vibrant team that go out into the community, talk to people, and the people willingly donate. So when you come in emergency, we don't wait for you to bring your people. We give you the blood that you need. And then before you go, if you give you 2 pints, you have to replace 2 pints to make sure it is replaced and all there. But we also have constraints. The woman will be there and discharge, waiting for someone to come and give blood, and the families will not come to give blood. So obviously, along the way, you have to discharge those women. And then, you know, something is taken from the fridge, we have 2 less. And such things continue to happen. And then sometimes, I think it's socio-cultural. You have a man wanting to donate, the mother will tell, no, if you donate, you will not be able to perform as a man again. I've seen that. And we have to convince the woman, the man, to donate, but eventually the man declined. So what can you do? Just to give the blood, and then we have a shortage in the blood. But now, if there is a facility that also have that the blood bank, now it becomes a problem. So we have a lot of things, and also we have to talk to government to prioritize health system. I think that's also very, very important. Okay, in prioritizing health system, you have to make sure things are available. Okay,
I guess we'll come to that, but you're still
okay.
watching N24 TV, your innovative news, information and entertainment, and this is the issues that comes your way here on this TV. So back to what you were saying regarding women in their houses, they're supposed to be supported. But I do hear people saying a pregnant woman should not be lazy. You should not be always sitting down, give me this cup here, give me the remote, and doing all those. You should be active, going up and down, doing some pounding. I mean, that is, according to some people, it help to make delivery very easy
Yeah,
for the woman.
I think in general, pregnancy is not a disease. We have to make that clear. It's just a physiologic change. And then it should not make you feel otherwise.
Okay.
But you know, if you also have to transfer pregnancy to men, honestly, most of the men will be very, very lazy. No, it is very, very demanding. Okay, it is demanding, and people have to understand that it is demanding. Yes, we have to pamper the pregnant women. Let's take care of them.
Okay.
Okay, if you want them to work, there should be certain type of work that they do. Fine, they can do other things, but you know, rigorous pounding and lifting very heavy things are not helpful.
Okay.
They can sweep, they can cook, and all those things. Like I said, it is not a disease, but we also need to be supported. We cannot say because you are pregnant you have to be working more so that your labor and delivery can be easy. No, that's not the case. I think we have to make that clear.
Okay.
Pregnant women need to be supported.
Okay, you're still watching N24 TV, your innovative news, information and entertainment. Coming, Mr. Darboe, coming after nyame ko nyimu kurangal teme yalon ko ikafo cervical cancer. No jama kam solle batandi. Come ite me yalon ko ika itala doku be. Come, it's around that end exactly. Coming up when you guys have to excuse me. So when it comes to cervical cancer, what do you have to tell us? Come, you Minnesota Kafumuli when it comes to cervical cancer.
Okay, comme ya fanyami cervical cancer ka musol da manne muta ka to musol le keta multiple cervix soto ya lon ka wulu nyango be musol da manne kewol ma wulu nyango soto non ni ko cervix soto wulu nyango la bunda coming ni ko cancer keta kulti mialon ko falindiro le mialon ko amang control soto anon fanan milka fala men ke fe baloti mialon ko ado malta alors hade badu ko kambende ande bajara ko hade badu na menta aka benne natata fo afla temmedu lato e bajala ko balo bata fla fo fe min marta wo mengo nyala balo sa faye ko sa be ngo nyen kayandal bare cancer wala ni labe falen kan wala ka men bare fanan sel sol min bije mi an ko wala ka falen nan amanke sel sol ci mi an ko e normal ta anon fanan ala mengo nyen ab ko control do e bajala ko akadum balo dula dol do akada kulti mi an ko asiara dunya ko no bakela katum sawo sa mo kutol min kasoto niya yate akada fo mo wuli kebe lulu adem fek
okay
adem fanan mol mi an ko niyo katu jakata fo mo wuli kebe saba adem fek akada kulti mi an ko kansal be ko dunya ko milika musol batande atata kada kansal fula nyawta mi an ko asiara bake wala wala breast cancer wala sunjo la cancer niya jibe gambia jam cancer mi an ko mol niyo katu je bake wo keta cancer de mi an ko wala keta cervical cancer katum kula mi an ko jama jani ka kala muta aka kole aka tar aletta gambian na ko sirobe nyame wala kemo kemen ni an ko wala safo tawotan nimmi ya suta muta ko ni ba kalam tala wate wado mo sewo be ta katal ko aletta la already anu naletta ite ku no la je wala mpuka mari ma ko na ko dula kan de mi yow boro diala kadum kula melan ko eta jara no la nata na fata stage to andu ibajala ko wolle ke ko molti melan ko e ka dimin na soto ba ka aka dimin ba ka kansa ka dimin ne anu fanan kamen fo slow and painful death wala ila saya nyin katal domande abgataria ada ka ke sayal timi ko adimin tabakele wala na cervical cancer ka kulde mi ko pour nga wuli nga kele akuma tabakele.
Of course. So cervical cancer munika nati munika cause
coming cancer ni ajibi ku jama la bi jemil ka cancer sabu bar cervical cancer la silo neo jibe ibajala kambe fo HPV wala imaje nyim pengol min kerin kata primary school ka diningol pengo wo HPV ateka 70 to 95% of cervical cancer tel ka be sabu wala kemo keme cancer min bako cervical cancer min bako tawora wala kata fo tan kono tin lulu nying HPV la ka sabu ani HPV virus wala mi yalan ko aka mulmuta anda ka sawu mol tema soko ni futu mañol ke woni muso ni futu la ka sawu futu wol tema mo kete ko mi yalan ko cervical cancer ka sabule anin fulan jango mi yalan ko kamen for risk factor wala ning ila family ko no moya soto ite fan sa soto dole wala ko min na mantra family min kono wol ko min la soto katara nyama ne nabe family min kono wala family min ka ba kono wala la moya soto wala katara ya ka soto baake anen siga sabo fanan yalo gambia ko min kajala ko musol jama bu ka siga saba bar siga ni min ka saba ba jala ko pour yin cervical cancer soto akasiya wala kono baake anen ku jamal be jemi yalan ko fanan ka saba bar nyellem pour de yalan ko jama ni yewol soto ba jala ko cervical cancer ka saba no.
Okay. Cervical cancer a serious tabakele no jama ngalo ne ko mo jama aka sunkoto ndingol hani musol fango comme ila bunkono futuo ake watani bakele exactly it disturbs them in their marriages. So ngalo ne ko time sotale no time of covid bijane nga jele ko comme itol mel yalan ko itol marali wala e kata school to e kanyi sunkoto ndingol pengu pour kaje ko ñing cervical cancer ita sotola bari mo jama ya confusing dila ni corona jama kaje le ko parents sol ka foyene ni mo na rayla school to pour que pengu yebori ka to ina tala pour que pengu corona wo confusion o be kerine no yeah. So how did you guys cope with that?
Comme ya fanyami mbar nga commencé wala cervical cancer na be mola ka futo ko len da bakel katung jama hanala taman sel kono comme ni aje wati be futu la futu ke dimi mbake ado futu ke woni musote ma manyala kala kulti mi anko adiminta bar naka dimi ke bake e bajala ko wati no dimi ko ni amari nyanta kata loptana ya fanga jibe anem fana ni momi an ko wati aje ko kay to yelo jela hana man tara kurola o fana nyanta kata la ya fanga jibe wala ka kuro jabar kuro ni ngay sembo soto bake wala ka mel je jio min ka fendi la siara bake la yalla ko amanke jiti mi an ko normal ta nyanta kata loptana to e priye fanga jibe ka be foni sabaka kan sabe la fatela pengo ñing a commencé tala janning covid binala ay bajala ko ya test bir kama ma fa wala am ko men testero ti baga ala testero kete nyam ko sa banku dolto anu bankol jamaaya tale fo ya dindila système ko anu gambia ni nata vaccination la wala pengo la karola man tara koma ne aje dinding pengo lu bajala ko afrika jang be nyaato bakel adu han dunia ko no fam be nyaato bakel dinding wala pengo la karola bari min keta coronavirus atanin kuma jamane nata adon kumolu avec la vidéo tila bang message sur le cool siata bake adon kuma ka on nasiata pour mbol mi yalan ko be so kono ya jibe ko nyimu to nyaati amanke to nyaati aka ko le abake adon fana abanga ko min mol ni karanta be même le temps do ko wala wol balo nako nyim kuma ka amanke to nyaati bari modol bimbi ji hani karanta e ba jere ko kunyu ko manke janni bal nako nyim manke to nyaati aka sembo sura no vidéo jele lo tanol dolto asafulla karambo dolto molbe borla ko ha pengu lalla nata c'est même fo mole wala coronavirus pengu mimbe bul gambe jang abuka di dindi wala mi yalan ko be sanyi tanen se kata duma anu ni cervical cancer la pengu jibe di sungude ni mimbe sanyi konondo tara sanyi tanen nane e ko le pengu ba ni yo fo mole sa fo ha ni aje ka dinol pengu e malla fi wulo bar mimbe je wala e ka di mol la mi yalan ko e jikira ko nyin to yatunya HPV wala virus o jikatan kamina ande man dunga balo kon andon ko mi nga fanya me ka dum mo balo kon nyaade long futu nyoma fulol tema bari jikira ko ase ko la nyaawo nya ka bo sanji konon to kara sanji tan nane jikita ko wol jama bi je wala isa fo mume wol man kewol long folo wala tan ne ka di wala ka to jama jama ne adi mo la mi yalon ko balo nyin HPV soto la fo pare ibajala ko pengoni se bobu kana soto wala tan ne ka fo kabo grade 3 kata fo grade 8 ibajala ka di wala la bar ko min kibaro nyin asiyata le bar ko min an kamin fo risk communication lam fo e findi ni mo le kacha anu mo fanante pengula tara wulula man so wala na janning abakela karam nyama bi je ye PTA meeting kele wala nan ka fu mo le ko ni PTA meeting ni ko man do ko wati mo nyanta ke danko la kato dingol be karam mo do ni temanta o meeting la kul kacha ta dakoro keta ni nata moy ko pengula la nata andite mo nyami ko pengula mi nata nata dingol le pengu ke fa wala coronavirus pengu nata wala nyama so e bajale ko abakela kulde mi lan ko sangata no bake mo findita le andum diamon siata bake baran kam min fo mo le wala kay min fo wala ni mo pengu nyim HPV vaccine la e bajala ko 70% iksolbe tankano cervical cancer
Okay.
amata ke mo ke mani mo tawrawlo tankande cervical cancer wo mu kubalate
Okay.
wala na pengo nyin akumata bakela.
Okay. So you're still watching N24 TV, your innovative news, information and entertainment. When it comes to cervical cancer, what are the signs and symptoms? Coming, ibalo no le ko coming cervical cancer totally. Aka mune finti li la balo kono.
Coming tamansel mi yaron ko isa sobila no wala coming afo nyame ni aje kayilo bo wate kato ngala ko musoka kuro jele kare o kare. Dolta ka comme abuka karosi til mo wonen kele bol dolta ka karosi la dolta ka tambe karol do mande bara muso yalla ne nyanta kuro jele wato min bara nyaaje kuro teme kayilo je baake nyanta katala je cek pour yaaji be fo cervical cancer bi la fatije andu malaf mo yaaje ko mi nga nakuro wakare o kare ngaje doro yesila ko hanga cervical cancer soto handi alors ni man kulfu nan ko indi kana ka kuldi anen ko min ka jiyoji min ka boyla wate andu yalla ko muso to nyata ka jiyo bonle bara jiyo ni fana dan lala soto bare baje ko ni ka jiyoji wate mi yalan ko fanga ko nyimman normal inda katala pour ye check anen mom yalan ko kay la kuro je bare yaje ko ni wate la kuro ala yelo kasiya bakela o kada kuldi mi yalan ko foyta ye check anen yaje ko to yata e kono kata dimle keno ko to andu iteka ibalo bitakan ibalo bankan andu domoro man di ibalo yenta katala pour eta loptaro te yefuma check anu wati check ro akumatale anu gambia ko keta kulti mi yalan ko akolata molbul hanni ko yela check wala bang fo presole bang molbu ka check ro ke wati bare pour cervical cancer screen akumatale wati pour kata loptano to ye check ka jibe fo HPV bi jel katon kukeli mi jemi yalan ko akumata ni HPV soto den ni ba flo ko abitala fayake infection to fayake pre-cancer state wala janning cancer binala ka minke cervix nyinna ibajala ko aka wato tala banni te ka cekiro ko wate ibajala ko ni aja ko HPV bi jele e se borol dila mi an ko seta nole janna bitala pre-cancer state ana tala fo pre-cancer state fana nabo wato la e se borol dila mi an ko abe bola woto ay murun kata normal ba ni mo be ke fo wato tata fo tata ko tata cancer de dron ning ale ma ko cancer comme ni akalamta juna se minke no wala yo operation ke yela cervix bondi wala yela wulu nyongo bondi bare comme ning akata wato mina mi ko a janyanta balo kono le hani yo bondi e kamari toral dro kato na fata tar la je
okay kon laftan la nala no wolto comme alcatrit nyami comme mume yalon ko a start cardiac and then atata lopitano to fal ba jara no len nabang ani mume yalon ko aya balu tinyal already it's already serious and atata lopitano to for does it have any solution
comme ngafo nyami ala jaralo wati le bal ni fintira juna yaje ko HPV be la waka jarano yaje ko fanan be stage le mi alan ko imam futa cancer la stage to follow bari be da saran cancer la stage ni fanan bi je fanan ka jarano ba ni man woman jara fo fata cancer stage la don o mu promote o buka murunno kata koma e bajala ko misi ma ko wala nin cancer bi yaje ko abe wulu nyama damane to amanta balo karadol la wulu nyama nyinka bole wala wulu nyama la bundanya cervix nyi da manka bondi no la o operation ka kenol ba nakere wato min mi anan ko ajanyanta balo kono o kutije se min nono adu ni be loptano to ko mol jele mi alan ko ye cervical cancer soto ite kuma fono le wala po ye takana anu nin dimi mbale kana cancer anu borol mi alan ko sembo so de ko le dila pour dimo nyi setala kamin dila wala kamin fo palliative care ka mari comfortable ndi dimi ngoytala bari wakatarre ala ko tonya kutije mi alan ko asekeno watola.
Okay, that is really important. So we've come to the end of this edition of the issues, but before we go, the last question: if you get to know that you have cervical cancer or you've seen these signs and symptoms within you, which of the hospitals should you go to go and do a cervical cancer test? And if you should go, what are you going to tell the doctors and the nurses?
I think if you see any signs and symptoms, it's important you get to any clinic. Just start with any clinic that is close to you.
Okay.
We have a referral system. We don't need to tell you, okay, if you are in a village, go to this particular hospital. If you go to the next line of hospital that is close to you, the closest to you, get there, make your complaints, and they will know whether to take care of it or not. If they don't have the facilities, they will refer. I think that makes life easier for everybody. Before you leave from one place to another, to go there to be told that, okay, it is not available or so. It's better you visit the closest facility to you, and then they will know when to refer and what to refer to a higher level.
Okay, this is really, really important. Cervical cancer is actually a cancer that disturbs a whole lot of women, especially women in their marriages. And it's advisable by a lot of doctors that married women should be faithful to their faithful partners. Exactly. It's important to be faithful, and parts of the signs and symptoms is discharge, having discharge all the time. And you know, when having an intercourse with your husband, in most cases, the only thing you feel is pain. So these are the things that Mr. or Dr. Darboe have told us. But then before we take our leave, you just have to
my last
what
one, I think I have to come back to what you just said. I think because when we say HPV can be transmitted through sexual intercourse, then we have to also advise people on responsible sexual relationship, and that fidelity comes in play. When you have a wife, stick to that. When you have to, stick to them. And then when you're not married, you abstain. If you cannot abstain, we say you stick to one or you protect yourself. It's very, very important. And cervical cancer comes at a time when a woman is socially and economically a very important structure in the family. In the 30s and 40s, we know how important a mother is in the family, and usually that's the time that they attack with this the cancer. So that's a time that usually is very difficult for the family, and we need to support each other to make sure that we are able to detect cases very, very early and take care of them effectively.
Thank you so much. We need to be there for each other. It doesn't mean that if your wife has or have cervical cancer, you should run away from the wife, or because you'll be saying my wife smells and I don't enjoy my marriage anymore with my wife because she has cervical cancer. We always have to be supportive to our partners. Thank you so much for joining us.
You're welcome. Thank you.
And we've come to the end of today's edition of The Issues. Thank you for joining us. This is Sukay Jajusi, and you were watching N24 TV, your innovative news, information, and entertainment. Until then, it's a bye from me.